Morning guys, it's George here, and today I wanted to follow on part of the conversation that we were having yesterday where we were talking about a pathway to doing sexual health screening for men, in particular men who have sex with men. I agree with the commentary that has come that MSN it is a bit of an unusual term. I don't know many people who use the term other than academics. Now, the thing is that when we are doing sexual health screening, we are trying to identify sexual behaviours, not identity. So I don't actually ask anybody whether they're gay, whether they're straight, whether they're bisexual. It's none of my business. What I do ask is what sexual behaviours they have had. And the way I preface this is if it's somebody I've never met, I'll go, look, we've never met, just a couple of quick questions if that's okay. Can you tell me, do you sleep with men, women, or sometimes both? Get used to saying it. Do you sleep with men, women, or sometimes both? It should roll off the tongue as if it's the most natural thing. I would like a cup of tea. Do you sleep with men, women, or sometimes both? So that's the first part. And if they do identify that they do have sex with men, then the next stage that I go through is I need to identify whether they've had anal sex, anal penetration, or whether they've had oral sex or oral penetration. So the questions are, have you had any fingers, toys, or anything up your butt? I would like a cup of tea, please. Have you had any fingers, toys, or anything up your butt? Really, really easy. Remember, if they say no to that question, the next step is remember that gonorrhea can be transmitted through saliva. So, okay, and then I'll go, oh, have you had any rimming or anything like that? Because sometimes gonorrhea can be transmitted through saliva. So rimming is for the people who are not in the lifestyle, rimming is licking bum, basically. So saliva to bum can actually transmit gonorrhea that way as well. So have you had any fingers, toys, or anything up the butt? If the answer is yes, then they get an anal swab to check for chlamydia and gonorrhea. If they say no, check for rimming. If they've had their ass licked, they also get a swab for chlamydia and gonorrhea. And then after that question, most people, that's the most shocking question. So the next question asked is, have you had anything inside your mouth? I'm not direct, I'm saying, have you had a penis inside your mouth? I just say, have you had anything inside your mouth? And that's most people, if they've done one thing, they've usually done the other. And that generally covers everything. So remember, a full sexual health screening for men who have sex with men is an anal swab for chlamydia and gonorrhea, a throat swab for chlamydia and gonorrhea, a urine test for chlamydia, gonorrhea, and also consider in people who have dysuria that's chlamydia and gonorrhea negative, do think of Mycoplasma genitalium. It takes longer to get tested, but it is worth testing for. And finally, a blood test, and that is for HIV, syphilis, hepatitis A and B. I like to check their status to see whether they've been immunised. Hepatitis C is now considered a sexually transmitted disease as well. When people are doing urine samples, I always say we just need the first part of urine that comes out of your body. We don't need gallons, we just need enough to fill, say, half the jar. And that tends to work for me. I can make another video that talks about the techniques that I use for doing the swabs. And I'm a little bit anal retentive on this one, that I like to do the anal swabs myself. And the reason for that is that, one, at least I know it was done right. And two, it's an opportunity to see the person's bum. I've picked up lots of anal warts. I have picked up syphilitic cankers, and men who have sex with men are at 40 times the risk of anal cancer than their straight counterparts. And if they're HIV positive, it's 100 times the risk. If you don't look, you won't see it. Anal cancers are very easily treated when they're less than 1 centimetre. If they're bigger than that, then it's literally a pain in the ass, because they need chemotherapy and maybe surgery and radiotherapy as well. So anyway, I hope this is helpful. I hope this is useful. And I'm always happy to make videos. If you have further questions, pop them below this video and I'll do my best to make sure I get a great answer for you. I'm loving the interaction on this conversation.